Thank you for joining us, guys. My name is Parvina Baldeo. I am the program coordinator for MCPAP and MCPAP for Moms, and I will be introducing our speaker for today. Today's topic is Hotlines, Helplines, and Resources in 2026. In addition, the next webinar will be held in October, and we will cover a substance use disorder topic, but we will share the more information, and we'll have an invite sent out to everyone, so you'll learn more about the webinar taking place in October. Before I present or introduce the presenter for today, I do want to go over some housekeeping items. This session will be recorded and available on the MCPAP for Moms website. A copy of the PowerPoint slides will also be available on our MCPAP for Moms website. And you can find that, the recording and the slides, on the Resource for Clinicians tab. And that will be within the PowerPoint presentation section of that tab. Our presenter will stop for questions at several points during the presentation, and there will also be time at the end. But if you have a question or comment, please type that into the question box during the presentation. And what we will do is we'll read out your question or mute your line to enable you to ask your question to the group. We are now, as you know, most of you know, we are offering CMEs for our webinars. So after the webinar, what will happen is you'll receive a brief survey, and we would appreciate your feedback because this will help us improve future presentations. If you are planning to claim CME, you are required to complete the survey. What we will also do is we'll add that link to the survey in the chat box during the presentation and towards the end of the presentation as well. And so we're going to introduce our distinguished presenter, who is Dr. Aruj Haider. She is the medical director of MCPAP for Moms, the medical director of Women's Mental Health Clinical Services, and assistant professor of psychiatry and obstetrics and gynecology at UMass Chan Medical School and Memorial. She is a consultant psychiatrist at Lifeline for Families and enjoys giving state and national talks on perinatal psychiatry access program impact and important women's mental health clinical topics. She also serves as the medical student clerkship director for the Women's Mental Health Elective in the Department of Psychiatry and has received numerous awards in trainee education. Her particular clinical expertise is in caregiving support and sleep, perinatal OCD, and psychosis. So I'll just hand that over to Aruj.
Thank you, Parvina.
Thank
Hi,
you.
everybody. So just give me a second to just screen share. Okay. Can you see my screen?
Yes.
Okay. Do you see my presenter view?
Yep.
You see my notes on the left side?
No.
No, we see
Okay,
just your slides.
Yep.
Perfect. Great. So let's get started. Okay. Hi, everybody. So, sorry, give me one sec. All right. So today we're going to talk about maternal mental health hotlines, helplines, and resources in 2026. So this will be a comprehensive view of kind of everything we have out there for perinatal resources, hotlines, helplines, specific resources. I'll talk about PSI in detail because they're such a tremendous resource across the country. We'll talk about our SUD initiative and MCPAP for Moms and some specific SUD resources. And then we'll talk about how MCPAP for Moms can help in that exact process for resources and handing it over to you and your patient and you know, how they're tailored. So if you have any questions, feel free to put that in the chat. So I like this graph because it's a pretty nice review of the 3 national mental health hotlines in the country. And so we have PSI, we have HRSA's funded maternal mental health hotline, and then we have SAMHSA's 988. Now, we're often asked at MCPAP for Moms, which hotline or helpline do I give to my patient? And even as a provider, how do I know who to call and first? So before I kind of go into this, I think it's important to remember. So first we'll talk about PSI versus MMHLA. So the first two columns, PSI is in the purple, MMHLA, which is HRSA funded, is blue in the middle. So PSI, Postpartum Support International, I think of PSI as kind of the biggest maternal mental health resource website, database, referral net in the country. Everything is essentially free, and MCPAP Proms collaborates with PSI closely. We have a wonderful relationship with them because they really do a great job vetting resources and kind of creating this community for patients and providers, and they offer a lot of resources and certifications, virtual support groups. So PSI, it's a volunteer-based organization, and it's a crisis helpline. So you see that on the left bolded. While the maternal mental health hotline has so the maternal mental health hotline has counselors, and it's available 24/7, and it's staffed by clinicians. It is better to recommend in a crisis situation as it is a hotline. So PSI is the helpline. MMHLA is a hotline. In Massachusetts, we also have the behavioral health helpline, which I'll get into a little bit later, which of course is more generalized for mental health resources in the state of Massachusetts. And they function a little bit differently. They're staffed by clinicians. So in Massachusetts, we have the behavioral health helpline. Nationally, the helpline is PSI and the hotline is MMHLA when we talk about perinatal resources. So the maternal mental health helpline being 24/7 and nationwide is a little different versus PSI, which has that line that sort of filters their help seekers to their state chapters. So they can take, in my experience, about 1 to 2 business days to get back to you from a volunteer. So definitely not as immediate in response as MMHLA or in Massachusetts, the behavioral health helpline. So I also think of the maternal mental health hotline number as a temporary emotional support hotline that provides in the moment emotional support for their help seekers. They will also refer help seekers to resources mostly via the PSI directory, or they will ask the help seeker to contact PSI directly for more specific resources that are not readily available to them. And so just remember, I think the takeaway here is PSI, it's a helpline that is 8 a.m. to 11 p.m. and the voicemails often take 24 to 48 hours to return. And in Massachusetts, the behavioral helpline, it's 24/7, 365 days a year, open all holidays, every second of the day. You can call, text, or chat. So available for more immediate assistance. So PSI's number is there, 1-800-944-4773. That's the website. It's a helpline, and help seekers can call or text a message, and volunteers respond within 24 to 48 hours. Then we have the MMHLA, which I just went over. 1-833 Help Moms is the main number. It is a hotline for individuals who are not in crisis but need real-time support and assistance for maternal mental health conditions. It is also 24/7, 365 days a year. They respond within 5 minutes. I think of that as analogous to Massachusetts behavioral health helpline, and their clinicians can absolutely help with perinatal mental health conditions as well. And then we have 988, which a lot of you may know, which is directed and led by SAMHSA. 988 is essentially the national suicide prevention line in the country. It is a crisis line. So we're going from helpline to hotline to crisis line for individuals needing support for a suicidal, mental health, or a substance use crisis. And I think that focus in substance use is important because substance use is often siloed in psychiatry. So SAMHSA can definitely manage those conditions as well. It is also open 24/7, 365 live connection within 60 to 90 seconds. So for more imminent mental health concerns. So, I mean, here is kind of a review of some details of the resources. So PSI, it's administered by PSI. It's available in English and Spanish, but I also believe more languages. So I think that is a little outdated. They all have the ability, all three of these numbers have the ability to call and text, with the exception of SAMHSA 988. You can also chat with them as well. So a little bit more interactive and functioning. And PSI is staffed by volunteers, which is why they take up to 1 to 2 days to get back to callers. MMHLA is staffed by paid professionals, clinicians, and 988 is staffed by both paid professionals and volunteers, and available for most immediate imminent concerns. That's what I would say about those. And this is another pretty nice review. Feel free to screenshot this. So how to get help for mental health, the PSI helpline. This summarizes everything we talked about, the National Maternal Health Helpline and the National Suicide and Crisis Lifeline as well. And I'll talk a little bit about PSI because we often get a lot of questions about PSI, and a lot of our resources may stem from or come from PSI, depending on what they are. So Postpartum Support International, it's essentially a nonprofit organization dedicated to promoting the mental health of perinatal individuals, whether it's preconception, pregnancy, or postpartum phase. And their mission very much aligns with MCPAP for Moms. They really ensure that all families receive timely support and quality care for perinatal mental health. The key services for PSI is, as I had mentioned, there are additionally a few more. So they have the helpline for information and referral support. They have online support groups led by trained facilitators. I think this is one of the most popular features of PSI, and it's something that I get the most feedback on from my patients. These support groups are virtual, 100% virtual. They can be anonymous. You can turn off your video, your audio. They really protect patients' anonymity, and I think they're one of the most favorite features of the organization. They also have a provider directory to locate specific perinatal mental health specialists that they update pretty frequently. They have educational webinars. Their fact sheets are great. They have an excellent postpartum psychosis fact sheet that we often refer to here at MCPAP for Moms. They also offer, so this is on the provider level, but they offer professional training and certification for healthcare providers. If anyone is interested, feel free to reach out to them. And they do a lot of community awareness campaigns to reduce the stigma around perinatal mental health. So our MCPAP for Moms has a directory where we really vet all the providers constantly. We have a big, wonderful team of research and referral specialists, and they're always vetting the psychiatrists, the psychologists, the psychiatric clinicians, doulas, any kind of perinatal care professional or prescriber in the state of Massachusetts. As you can imagine, it's a full-time job. So we have that, and we also, if needed, will refer to PSI's directory if it's appropriate for that patient. So that's kind of like a broad overview of the vetting process and the three main hotlines, helplines, and the National Suicide and Crisis Lifeline. So how exactly can MCPAP for Moms help during this process? So MCPAP for Moms can help provide a solution by building the capacity of perinatal care settings to provide mental health care. So we do this through three main mechanisms: resource and referral, education, perinatal psychiatry consultation, which is comprised of two facets: the phone consultation and the one-time face-to-face evaluation. About 10% of our calls become face-to-face evaluations, really because the capacity of obstetricians across the state and all providers and perinatal care professionals that have called us has really, it's been impressive how much their capacity has been built. And a lot of prescribers out there feel comfortable with our help and kind of holding our hand, prescribing their own medications. So we have the ability to do face-to-face evaluations if, for example, it's a complex patient, if it's something that the phone consultation just really isn't sufficient for, if it's a specific patient request, if it's something, nuanced medically, psychopharmacologically, or something specific about SUD, really a variety of reasons why we may do face-to-face evaluation. And it sounds like that is a very impactful component of the program and the resources that we offer. And then we also have those phone consults, which a lot of you are familiar with, where anyone can call and get connected to a perinatal psychiatric consultant if it's appropriate. And we can talk about a number of things, including medications, specific combination pharmacotherapy, different types of therapies, just really maybe sometimes running by psychodynamic aspects of a case, anything and everything. So that's what we're here for. This webinar is an example of education, and resources and referral is really what we're talking about now in this webinar. So since our launch in July 2014, MCPAP for Moms has served many clinicians and parents across the state. We serve about 300 to 400 unique individuals each month. We've enrolled almost 80% of obstetric practices in the state. The majority of our enrolled practices are utilizing us. And to date, I think that number is inaccurate, but we've served about 26,000 distinct perinatal individuals since the program was created in July 2014. And our research and referral encounter arm is the busiest aspect of our program. And we've had about over 26,000 encounters at this point. So we are often asked in MCPAP for Moms, who can call MCPAP for Moms? The answer is really anyone can call. While we only enroll OB practices, anyone can call. So obstetric providers, midwives, doulas, you see at the bottom as well, family medicine docs, SUD care providers, psychiatric clinicians, pediatricians, primary care providers, therapists, psychologists, anyone and everything. So patient consultations are for licensed independent prescribers. Because MCPAP for Moms is on a patient-facing program, we do not prescribe for patients. The goal of the patient consult is really to help triage the patient and decide whether this is a patient you can manage with our help, or if this is someone who needs to be seen by a psychiatric provider. Or if it's unclear, but it seems that the patient is likely someone who will be able to be managed by the primary care provider, we can see the patient for a one-time face-to-face evaluation, but only after that phone consultation is done, because we need to be able to make sure that the prescriber can prescribe after the face-to-face evaluation. And if appropriate, we can certainly also help out with care coordination after a patient consultation. So after a patient consultation, depending on what we decide in the consultation, we can get the care coordinators involved to help with referrals to therapists and linkage with community resources. So providers can call 855-MOM-MCPAP for consultation for mental health and SUD topics anytime from 9 a.m. to 5 p.m. Those are our business hours, 5 days a week. We're always open during that time. So you call 855-MOM-MCPAP, you're linked to a research and referral specialist live, or you leave a voicemail. If you leave a voicemail, they will get that information, triage it appropriately, call you back to clarify more clinical information if resources need to be made, or if more information needs to be handed over to the consultant on call. So two things happened during this phone call. So they can either, our research referral specialist can either send resources directly to the provider, or do a provider to provider phone consultation. After that, there is the option of either a face-to-face consultation, depending on the case, a resource is sent directly to the patient contact, but that phone consultation has to happen first to discuss clinical features of the case, make sure there are no safety concerns, and really our psychiatric experts have to do, have to do their due diligence to make sure that the clinical case is being handled well by an expert. So so that's kind of how that flow happens at MCPAP for Moms. And just as a caveat, patients should provide consent in order for you to share personal information with MCPAP for Moms, and we can offer resources to patients if they're aware that we are calling on your behalf. So just wanted to clarify that patient consent needs to happen. So consultation really is the engine of MCPAP for Moms, is what we've seen. And during the consultation, we can discuss potential management strategies, recommend a face-to-face evaluation, or refer to the community. So the resource and referral is based on acuity, severity, and need. And specifically, how our resource and referral arm of MCPAP for Moms works is our resource referral specialists will get the information about your patient. They will identify at least 2 to 3 targeted resources and share them in a list form with a provider. That does not involve speaking with a perinatal individual. For outreach to patient or patient contact, the research and referral specialists will contact perinatal individuals and work with them to schedule the appointment. They will also follow up after 1 month. So when you call us, we have the ability to send the resources directly to the patient, only to the provider, or both. It really depends on what you and the patient prefer. We also include the National Maternal Mental Health Hotline, Massachusetts Behavioral Health Helpline, PSI Helpline, and resources to patients, anything and everything that may need it. And we send the resource list to the provider within 3 business days. So our turnover is pretty fast. If that's not happening, please let us know. We will work to fix that. But within 3 business days is usually when it happens. And so just as a caveat, for patient contact, no consult is needed, but we do like to have an EPDS score. So if it's 19 or above, or an answer other than no on question 10, we require a phone consultation with a referring provider and one of our consultants before reaching out to the patient. We then attempt to reach out 3 times over the course of a week after that referral. If we do not hear back, we send the list to the provider and we don't contact the patient after that. So 3 attempts is kind of why we send it, is when we send it back to the provider only. For the patients we do reach, we ask them about their preferences when it comes to therapists, prescribers, virtual, in-person, time of day, gender preference, really in person or not, anything and everything. We really do our best to curate the list based on patient and provider requests. We email a list of people accepting new referrals who accept their insurance, and sometimes, or fax. Sometimes we can directly refer by filling out a form on the patient's behalf. Once it's sent to the patient, we'll follow up in 2 weeks to see if they connected with anyone or have any questions. So yes, so that's kind of a high level overview of research and referral. And so 855-666-6272 is our phone number. We're 9 to 5. We also offer trainings and toolkits. And the consultation resources I went into, the training and toolkits, I'll talk a little bit more in detail towards the end because we have some updates on that. So again, MCPAP for Moms aims to promote maternal and child health by building the capacity of frontline providers to address perinatal mental illness. So there are various toolkits and e-modules that are available for obstetric clinicians through ACOG, and MCPAP for Moms and Lifeline for Moms, based out of UMass, have partnered with ACOG to really produce these amazing grant funded resources that are available for free for everyone. So there's the perinatal mental health toolkit that's available on ACOG. There is the more comprehensive one, the Lifeline for Moms perinatal mental health toolkit, is on the Lifeline for Moms website at UMass, and that's about 40-something pages. That's a very comprehensive review of all perinatal mental health and SUG concerns, everything from screening to basic introductory concepts on perinatal mood and anxiety disorders, to trauma-informed care, to substance use, to specific terminology that you should and shouldn't use. So that's a more expansive list. There is a shortened version on ACOG, and ACOG owns that, and that's on their website. So 2 versions of the Lifeline for Moms OB toolkit. And then there's the NIMH, National Institute of Mental Health e-modules, which I love because they're very interactive and you can do them in just a few short hours. And there are a lot of very raw and accurate clinical cases that you go through and you click through to really understand important perinatal mental health topics. So highly recommend ACOG's asynchronous modules. They're asynchronous, which means you can do them on your own time. It doesn't have to be live. So I'd like to talk about the Massachusetts Behavioral Health Helpline and other services related to that, because this is a big resource in Massachusetts that I hope that all clinicians and perinatal care professionals can utilize more. So the Massachusetts Behavioral Health Helpline, 833-773-2445. It's free, it's confidential. No health insurance is required for any of your patients. It's real-time interpretation in over 200 languages. They offer a full range of treatment services for mental health and substance use. They also offer, depending on what the patient needs, outpatient, urgent, and immediate crisis care. So they can also link patients to CBHTs, which are the community behavioral health centers, which I'll get to in a moment, mobile crisis services, and CCS. So I think the important thing to know is in Massachusetts, the criteria to get someone to a hospital in Massachusetts is really three main things. So risk of harm to self, risk of harm to others, and you can't function in the community. MCPAP for Moms is not an emergency consultative line. And so if you have any questions about, a safety concern, if there's an imminent threat, meaning that timeliness is critical and the patient is potentially at risk of harming themselves or others very urgently and imminently, you don't call MCPAP for Moms. You want to get that patient to a hospital as soon as possible. You can call them a Massachusetts Behavioral Health Helpline or call 911 or crisis. So really anything non-imminent in nature, we're able to help with. But if we don't expect you to know that right away or really to distinguish imminent versus non-imminent, especially if it's not clear, because sometimes it's just not clear. So call us, and in that situation, we'll guide you and we'll tell you, okay, we can help you with this patient, or I think you need to get this patient to the ER. And in that case, we can also help tell you how to do a Section 12 form, which is the form for involuntary psychiatric hospitalization in the state of Massachusetts, what that looks like. We can, send it to you, help you fill it out, etc. So even if someone doesn't explicitly say, I want to kill myself or my baby, if they're unable to care for themselves, that can warrant inpatient hospitalization. So I think that's that's something important to remember, because sometimes people think that it's just suicidality or thoughts of infanticide or thoughts of homicide. If someone just cannot care for themselves, that they could also be sent to the hospital, to an inpatient hospital for care. So the Behavioral Health Helpline, how it plays into all this, it's operated by MBHP. It's free, it's confidential. There's no health insurance required, as I had said. It's available in over 200 languages, including those who are deaf or hard of hearing, so very accessible. It connects individuals and families to many services, including outpatient, urgent, immediate crisis care. You also have the option to call for real-time support, initial clinical assessment, and connection to the right evaluation and treatment if you're not sure. So I think this gets into CBHC's MCI services and CCS. So the community behavioral health centers are really a one-stop shop for a wide range of mental health and substance use services and treatment, and in pregnant women. So it's a statewide network of CBHCs. I think we're 25 to 30 of them across the state now, and their goal is to offer immediate confidential care for mental health and substance use needs, including preconception, pregnant, and postpartum individuals. And they're open 7 days a week, and they have pretty excellent hours, from early morning hours to late night hours. And they can also help with prescription as well. There are also the behavioral health helpline. If you call, they may assist you or your patient, or family members can call too, by the way, to MCI services. And mobile crisis services will basically travel to the patient's location or work, and to the patient's location, and work with them if needed to send them to a CBHC to assess the patient and determine the best path forward. So instead of going to the ER, MCI services really allow anyone going through a crisis to either walk into a CBHC or call for a team to come to their location and access immediate mental health care. CBHCs will also have the Community Crisis Stabilization Unit, CCS, which is basically a less restrictive alternative to inpatient hospitalization for people in need of short-term overnight crisis care and third routine patient services. So I want to go a little bit into our SUD, the SUD initiative at MCPAP for Moms. MCPAP for Moms has a substance use disorder initiative that's dedicated to substance use disorder concerns in the perinatal setting. So please call the main MCPAP for Moms line, inquire about the program, and our SUD program manager, Gina Gallagher, will get back to you. The SUD toolkit took several years to create. It was finished in 2021, and it was just updated this year by our Associate Medical Director of SUD at the Brigham and Gina Gallagher, the Program Manager. It will be available on our website this month, very, very soon. It is a full the full toolkit will be available, and the first half is really focuses on substance use disorders, and then it's followed by several fact sheets addressing non-stigmatizing language, trauma-informed care, reproductive life planning, and the SUD setting. And the second half focuses on psychiatric concerns. So a little bit about our SUD initiative. I encourage you all to utilize it as much as you can. It's essentially like a sub-program of MCPAP for Moms, and it supports providers in treating perinatal individuals with substance use concerns. And it offers consultations on initiating and maintaining medications for opioid use disorder, other addiction treatments, MAT, and managing dual diagnoses involving mental health and substance use. The SUG program manager, who is very clinically skilled, will also connect providers with resources for referral across all levels of care, depending on the clinical needs of the patients. The trainings are provided on key topics, including screening, treatment, trauma-informed care for perinatal individuals, and SUD. Additionally, the initiative, the SUG subprogram, it develops a lot of educational materials and toolkits to support providers with all the up-to-date information possible. So here are a few resources recommended by our program manager for perinatal individuals with substance use concerns. So there are some IHR programs, Institute for Health and Recovery. Here, we're going to focus on some three main ones. So Women and Family Referral Center, they connect pregnant and parenting individuals with treatment and recovery supports, including direct referrals to residential substance use treatment and family supportive living programs, warm handoffs to all levels of care, interim counseling, and follow-up support. Calls are answered live Monday to Friday, 9 to 5, or returned within one business day. That's their information right there. Moms Do Care, it's a statewide program designed to provide multidisciplinary, peer-led, recovery-oriented wraparound support for pregnant, postpartum, and parenting individuals with a history of substance use. For more information about services and locations, please visit momsdocare.org. And then there is Promise. It's a caring and flexible outpatient program for pregnant and parenting people impacted by substance use. It offers assessment and care planning, individual, family, and group support therapy, recovery coaching, peer support, and intensive case management. And that's the information right there. And they're based out of Boston, I believe. Additional resources the MCPAP for Moms SUG initiative refers to and recommend: First Steps Together, Project Nest, the Journey Recovery Project, and Free Online Recovery Group. So First Steps Together is a home visiting program providing flexible community-based and virtual services. Project Nest, newborns exposed to substances, support and therapy, offers support and therapy for substance-exposed newborns and their families. The Journey Recovery Project, an interactive web resource for pregnant parenting women with questions or concerns about opioid and other substance use disorders. And then there's the Free Online Recovery Group, which is essentially a free online substance use recovery group through PSI. So I'm going to talk a little about postpartum psychosis resources, just because I think this topic has gained a lot of interest lately, and there have been some new resources for perinatal psychosis that I I think are very important. So there's the Postpartum Support International Postpartum Psychosis Get Help page. I think that's great. There's the Maternal Mental Health Alliance Postpartum Psychosis fact sheet. So PSI and MMHLA have two excellent fact sheets that you can access through these two links, and they really did a good job at gleaning the highest level information out there and taking into account experiences from those with lived experience. And I can't recommend these two fact sheets enough. There are also free virtual postpartum psychosis support groups. The Mass General Hospital Postpartum Psychosis Project, mghp3.org, I think is the website, out of the MGH Women's Mental Health Center. It's essentially it's a research study, and they offer a lot of resources on this topic, but also they conduct excellent studies on those with postpartum psychosis. So I invite you to check those out. There's also the PSI Postpartum Psychosis Task Force. And if anyone is interested in joining Massachusetts Mind the Gap advocacy efforts, please add your name on their website or contact their program coordinator, Jessie Colbert. So what do I do if there's a psychiatric emergency? Just wanted to iterate. So, and this is for perinatal psychosis or anything else, thoughts of suicide, infanticide, homicide, or if the individual can't function. There's active suicide or imminent concerns of postpartum psychosis, or if the patient is, floridly psychotic or manic, you want to take the baby away from the mom, put the baby in a safe place with family, and call 911. We want to get the mom hospitalized and get them an urgent evaluation as soon as possible, BHHL, crisis, or options as well. And that's the information for BHHL there again. And we talked a little bit about imminent risk versus non-imminent. We also don't expect you to know. So if you're unsure if this is a true psychiatric emergency, that's where MCPAP for Moms can help. Call us, or for any non-imminent concerns, we can guide you, tell you if you should do a Section 12, tell you if we think the patient should go to a hospital. So we're always here to help. A few MCPAP for Moms updates. So just so you know, doulas can call MCPAP for Moms as well. We opened the line to doulas earlier this year, and we've had several calls from doulas. Please call us more. We welcome you. You guys are great support navigators for pregnant women, and we are happy to collaborate with you, talk about resources, really anything and everything about your patient. If a doula is calling, since doulas are not prescribers, we ask if there's a medication question or concern, please have the patient's prescriber call MCPAP for Moms. Since doulas cannot prescribe, we want to be able to help you and offer that phone consultation, but we need to talk about medications with prescribers. So that could be the OB, that could be the pediatrician. If the pediatrician is prescribing for the mom, if it's a younger mom, that could be the family medicine doctor, that can be the psychiatrist, the psychiatric clinician. So our toolkits, MCPAP for Moms Obstetric Provider Toolkit, MCPAP for Moms SUG Toolkit, which I went into in detail, the Doula Link Toolkit, and actually the MCPAP Pediatric Toolkit for perinatal individuals have all been updated, and they will be on the website at the end of this month or early next month. And the MCPAP for Moms Obstetric Provider Toolkit actually hadn't been updated in almost a decade. So we updated that. It includes information about zuranolone, psychedelics. We are recommending the rapid mood screener instead of the MDQ, if that's a possibility for you in your clinic and the flow, just because it's much easier and faster to administer and score, and it has a lower false positive rate when compared to the MDQ. The algorithms have been updated, resources have been updated. So anything and everything, please check those 4 toolkits out. The Doula Link Toolkit is a great tool for doulas and non-prescribers across the state. So we take pride in our toolkits, and we would love to hear your feedback on them as well. For perinatal individuals with SUG, just as a reminder, Mass Health pays higher rates for peer recovery coaches and recovery support navigator services. 1-866-705-2807 Women and Family Referral Center is a resource. And the next MCPAP for Moms webinar will be in October, and that will be on substance use disorder. Here are some vetted resources that we highly recommend. MCPAP for Moms, ACOG, MGH, Women's Mental Health.org. They have a lot of great resources, good data and good explanation of data and studies, Reprotox, PSI, LactMed, and Lifeline for Moms. And thank you for everyone who helped me with this webinar. I'm going to stop screen sharing.
Yeah, so we have a few questions that came in. And the first question was, does the patient's insurance status play a role in assessing the services, MCPAP for Moms services, or does it matter when it is the provider is doing phone consults?
Sorry, let me just read that. Does the patient's insurance status play a role or does not? That's a great question, Vanya. Thank you for asking that. The patient's insurance is not an issue for MCPAP for Moms. This is a state-funded program, and even if the patient does not have insurance, we are here to help. I would say that's the answer. We help anyone and everyone across the state. MCPAP for Moms was built on the idea of access. It was created by John Strauss, a pediatrician who created the MCPAP program almost 2 decades ago. And because of the success of the MCPAP program, which he created to address the issue of just the shortage of psychiatrists, of child and adolescent psychiatrists, but psychiatrists in general. The model was applied to MCPAP for Moms, but the premise of access and access programs is really to provide care, excellent psychiatric care, and building the capacity of family care docs and pediatricians and OBs across the state. And insurance does not matter at all when it comes to that. That's a big, it's part of our mission. Maggie, thank you. Maggie says the behavioral health helpline will immediately connect you to a live person who can provide anything from information to staying on the line with the person in need until they connect to services needed, and will offer to follow up with the patient to see if they access the services and if they were helpful. Thank you, Maggie. That is very, very helpful. I know a lot of people may have questions about like how it works when you call behavioral health helpline, and I have to say they're fantastic. They will stay on, exactly as Maggie's saying with you, they will stay online until the person is in need, gets the help they need, or is connected to services, and they'll offer to follow up, which I think is huge. Yeah, they're a wonderful resource. Go ahead.
I just want to add that our MCPAP for Moms resource and referral team will also, when we're doing patient contact, we'll often share this with individuals because sometimes they're not ready to kind of proceed in accessing resources. So we want to be able to give them something that they can refer to on their own time, or if something changes, during non-Monday through Friday, 9 to 5 hours. We often share this resource so they have someone live that they can talk to.
Thank you, Beth.
Sure.
It's very helpful. Any other questions? Thank you, Kathleen.
I can also share that kind of going back to the question like about insurance, our resource and referral team really relies on the insurance information so that way we can connect with somebody in the community that accepts their insurance. And I think what often sometimes doesn't get talked about as much is that we can also find resources if somebody doesn't want to use their health insurance. They may want to pay out of pocket. If we have that information, we are happy to also identify resources where you can access it other ways, as well as like support groups for someone that might not have insurance or they're worried about co-pays. Often we can provide alternative resources, such as like support groups, which is a great way to kind of navigate when there's kind of insurance questions or concerns.
Thank you, Beth. We got a lot of questions about that, so thanks for clarifying. Okay, any more questions? Going 1, 2. Okay, I'm going to put my email in the chat. If anyone has any questions, just send me an email and I would be happy to answer them. Thank you everyone for coming. I think that's it. I hope you enjoy that high-level review of local and statewide and national resources. And I hope everyone enjoys the rest of their day. Thank you for coming.